Hello, welcome to Dr. RS channel. This is Dr. Riffat Sadiq. Today I'm going to talk about a very important topic, and we call it thyroid gland. Thyroid gland is extremely important for our body, and it lies in the neck, and it produces the most important thing, which is known as thyroxine. And thyroxine is just like a gas in our car. If we don't have gas, our car will not be able to run, or even you cannot even start it. And if we have too much of the gas, then it will be overflow of the gas, and it will destroy the parts of the car because they were like overloaded with the gas. So thyroxine is produced by thyroid gland, which lies in our neck, and everybody should pay attention to that. So we are going to go further into some details. What are some of the main functions thyroid gland does, and what are the problems we face if the thyroid is not functioning well? So it actually, main function of thyroid is it regulates our body. It actually makes sure all our systems are running in a smooth way. So we can walk, our heart can pump, brain can function, kidney can function. So thyroxine is extremely important in regulation of our body. So what are some of the problems we can have? Which can lead to the problem. We call it like a thyroiditis or iodine deficiency, autoimmune problem, toxic nodules. So these are some of the, you will hear all these kind of things. Iodine deficiency, then we can get like a big, we call it goiter. It's a big nodules in our, sometimes we can even feel it. So when I tell you all the time that you are your doctor, it means that you are your doctor because you are seeing your body every day. Sometimes you should feel it. If there is you feel any little bit of even enlargement of thyroid, you can actually even feel that. So you should see your body and feel your body on a daily basis for any abnormalities. So as I was telling earlier, so thyroid can hyperfunction, it produces a lot, or underfunction. So we can go into more details. When the thyroid is not functioning well or it's under functioning, what are some of the signs and symptoms we can actually have? What are the problems you should look for? Number one thing, if the thyroid is not functioning well, imagine that now your car is very slow. You are running on the low gas, so it's dragging. So you will have some fatigue, some weaknesses, weight gain because you are not moving enough, and you are like don't have energy to move on and do things actively. So you will start putting some weight on. So if you see that you are eating the same and you are gaining weight, it means that might be a problem. So you need to start watching yourself. Why I'm having, one time actually I started losing weight. I was eating the same and I started losing weight. So I thought there must be a thyroid problem. So you should watch for any weight gain. And then if there is weight gain, you need to have your thyroid check also. Cold intolerance, sometimes people feel so cold. That can be one of the signs. Dry skin, brittle nails, that you will see that people will have these problems. One of the most important, and I think it's a very common problem people face, is constipation. Constipation is extremely something we should watch. If you're having constipation, you need to get to your doctor. Maybe thyroid problem, maybe side effects of some of the medications, maybe some other problems of your gastrointestinal tract, the whole GI tract. Maybe there's something is not right, because imagine the If you're having constipation, all the things which should go into the garbage, it's staying in your body. It can produce a lot of bad things in your system. Muscle aches and stiffness, because you are, as I said, telling you earlier, the car is very slow, and you are going to have some stiffness and muscle weakness. Then joint pain, depression. That's very common when the thyroid is functioning under. Depression is one of the very common signs. You will see that a lot of time when people come to me and they feel like, I don't want to do anything, I'm okay. They will be withdrawn. They are not in a happy mood. They are like sad all the time. They don't want to go to work, or their grades goes down, or they don't want to talk to their friends and family. Maybe it was a thyroid problem. If you see your loved one who is normally more happy person, and now the person is sad, maybe you need to bring thyroid into the conversation. Maybe they need to see a doctor, and maybe thyroid needs to be checked out. Memory problem. If it's a thyroid is working low and we keep it unattended, we are not kind of paying attention. So what will happen is we'll start having the memory problem. You will start forgetting things. So one of my patients who was like 50 years old, and she actually started having the memory problem. She was working she was working on a cash register, and she said, every day I have some little mistake, and it's happening more frequently. If it's once or twice, that's fine, but if it's happening more frequently, there might be problem. So what I did, I just checked thyroid right away. So found out that her thyroid was not functioning well. We gave her the medication, so she went back to the normal. Her memory got better. So memory and thyroid, they go hand in hand. We need to keep an eye on that. Slow heart rate. So all the arrhythmias, we call it arrhythmia, regularly the heart beat in a very good pace at a regular interval. But if the heart is beating very slow, usually the normal heartbeat is from 65 to 70 up till 85. If it's like running slow, very slow, like in 40s and 50s, it means that heart is not pumping blood enough to the system. So we will be slowly not getting enough blood to our brain, to our kidneys, to our eyes, heart itself. So if imagine that our body, parts of our body are not getting the blood, what can happen? Our body is like a plant. When you don't water the plant, what happens? The leaves will be yellow first, and then they will dry up, and then what happens? That slowly one leaf will fall, the other leaf will fall. So we need to really make sure that we water them appropriately. Not too much water, not too little water. So the same way thyroxine works. Not too much, not too little. So the slow heart rate, we call it bradycardia. It's very, very important. We should keep an eye on our heart rate. It's very simple these days, even the phone, our, technology has is now so advanced that we can even test our EKG, our heart, blood pressure. Even if you don't have any of these things, just put your 2 fingers on your pulse and feel like how much is that. If your pulse is like a 65, 70, 80, that's good. But if your pulse is 45, 40, 50, 50 is even low, 60 is lower side, then you need to talk to your doctor and find out why your pulse is on the lower side. There are multiple reasons, but hypothyroidism or underactive thyroid is one of the cause of the bradycardia or the slow heart rate. So I'm sure that these signs, keep an eye on it, watch for anything which you are facing or your loved one is having it. Then it's very easy. Once a year you can have a thyroid test. It's a blood test. It's not a big deal. You can have it done. Ask your doctor to they will also talk about this, that how easy it is. Let's talk to the how we can go to the hyperactive thyroid, or the other name is hyperthyroidism. Now we have too much thyroxine in our system, and that thyroxine, what is when in the low thyroid we gain weight, but if the thyroxine is too much, our body is very active, so they're burning a lot of calories and you start losing weight. But this is not a good way to lose weight. If you're losing weight unintentionally, you are not planning to lose weight, so you're eating the same thing but you start losing weight, it's not a good way to lose weight, because what happens is then it can lead to rapid or irregular heart rate. So heart is beating so fast that it's not giving enough time to relax the heart, so blood comes back to the heart and then it throws back to the system. The volume is very important. So if it's beating fast, it's not getting the good blood back to the heart, and then we need a certain, heart has to beat in a certain way. Heart cannot beat slow, heart cannot beat fast. It has to be within a range, so that it get good relaxation, blood come back to the heart, clean blood, and then clean blood is pumped back to the system. So it's very important that we have to have an appropriate thyroxine level in our system. So again, you can check your heart rate. Sometimes you will feel anxious, you will feel agitated, because you are not getting enough blood to the brain and to the system. So you will get short of breath because you're not getting enough blood to the lungs. So you can get shortness of breath, chest pain, agitation, anxiety. All these signs are if your thyroid is working faster than we need. Heat intolerance, excessive sweating. So because your heart, everything is so fast, so you will sweat a lot. Sometimes people will have tremor. So if the tremors are there, before even you get tremors, you will get a little bit of anxious, heart rate is fast. Then the next level you will start getting tremor. So don't reach to that level. If you are having any symptom, you need to watch it, write it down. Increase appetite. Sometimes people feel like because their system is so fast, they need to keep eating. So that's another sign. Diarrhea is another sign. In low, when the thyroid is functioning on the under functioning, you will have constipation. But if it's over functioning, you will have diarrhea. So keep an eye on that. Again, muscle fatigue, weakness, goiter, because thyroid is functioning so much that you will start seeing the thyroid become big. So if thyroid, you feel any enlargement, you need to see the doctor. Doctor has to watch why you're having. There are multiple causes of low thyroid and high thyroid. So you need to get investigation. What are the causes? Some are very simple, which can be taken care of, but some can be like really, it can be infection, it can be cancer, it can be autoimmune disease. So I think to see what is the cause, then we need a proper investigation, proper treatment. There are treatment available for these problems. So we need to discuss the treatment in a next episode. But I hope that knowing that how thyroid work and what are the underthyroid working problem and the overthyroid working problem, I hope this is helpful for you. Thank you for watching. Take care of yourself. Be your doctor, own doctor, and subscribe our channel. Again, thank you.